NCCH and the Midlands Arts-in-Hospitals Network co-hosted a Workforce Wellbeing Huddle at Royal Derby Hospital. This huddle invited hospital staff, HR staff, and arts-in-hospital managers together to co-create solutions for low well-being in the hospital workforce. The huddle was facilitated through a series of creative activities. One example was the sharing of anecdotal evidence of how creativity has helped well-being. Members of the group shared their experiences, and snippets of what they said was scribed verbatim and turned into a poem. This is the poem that resulted.
How to speak to humans. The first response to the pandemic from staff was poetry. When there were no words, poetry. By its nature fragmented as memories after trauma. There's a power in that. Everyone laughing together on Teams. Hands crafting flow, willow, metal, clay. I have made this amongst the chaos. Being able to take it away out of the darkness. A manager marched her team down. Afterwards, she was beaming from ear to ear. I'm really thinking on my feet here. I wonder if staff have come to accept the moral injury. Maybe they've had to put it away. We bring them with us wherever they are. We go in with music for the patients, but really it's for whoever hears it. All the staff mopping and singing along, dancing to the fiddle. Where's the evidence? The data says the common thread is that they've engaged in something. They were there. They know it's there if they require it. It's 20% return to work from long-term sickness. It's variety. It's groups around the table where the conversations are so different. It's a vessel, a highway to the soul, the magic flute at my mum's bed. There's no medicine like that atmosphere, zoning in on the human. Great art speaks to the human, opens that up. I'm really angry that those people have said, you should get volunteers to do this. It's getting them to understand the value of safe hands, speaking two languages, this one and the language they understand, learning how to speak to humans.
Another activity we engaged with involved participants choosing a dixit card from the table and using it to inspire the creation of a new creative health activity. These ideas were also turned into a verbatim poem.
Bonkers Ideas. There's what an activity is badged as, and there's much more underneath. What might float their boat and what might ease the choppy seas. Walking together is physical activity, but you're also getting support. I want to host reminiscence walks through the old hospital, opening the doors, acknowledging movement. By every bedside, a portal to the outside world for staff and patients to use. I've become more aware of things that go on in the night. How can creativity help people who can't sleep? Dancing before bedtime. There could be storytelling, gentle music, a safe space after dark. I've just got excited about trauma and creative writing. I'm going to cover that hole up, or the hole might be their superpower. Getting people in the room, reading to each other, that primal connection. I'm thinking about a really weird project that I did years ago, a dancer, a sculptor, and a group of children. Wouldn't it be great to get staff to make values into contemporary dance, freeze frames into sculptures, bring it all in? Absolutely bonkers. One way or another, they'll love it.
Elsewhere on the day were a range of other activities, including the creation of a draft theory of change. A theory of change outlines who we want to be impacted, how we want them to be impacted, and plans out what actions and evaluation methods are needed to make this happen. The theory of change developed in the Workforce Wellbeing Huddle will continue to be developed by the Midlands Arts-in-Hospitals Network and will be implemented by the National Arts-in-Hospital Network. To hear more about other Huddle work happening across England, visit our website and check out our Huddles page. Or, to keep up to date with our work in workforce wellbeing, you can sign up to our newsletter by scrolling to the bottom of our site. Thank you.